Top 9 skin signs that may indicate your kidneys are damaged. It is important to know that skin changes usually appear when you've already been having problems with your kidneys for a while. Remember, early detection and treatment can make a world of difference in kidney health. According to the latest studies, more than 800 million people worldwide may experience chronic kidney disease. So, if you have any risk factors such as high blood pressure, diabetes, or obesity, or if you suspect kidney problems, check for these skin signs and discover helpful tips for keeping your skin healthy. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Skin signs of kidney disease. Some skin changes are specific to kidney disease, whereas other changes in the skin are nonspecific and may be associated with a variety of medical problems. 1. Itchy skin or pruritus. This is one of the most common skin symptoms in people with kidney damage, occurring in as many as 40% of people with end-stage renal disease, or ESRD for short. But what causes this itchiness? When the kidneys cannot effectively filter out waste products, urea accumulates in the blood. This buildup can lead to uremic pruritus, the medical term for itching caused by kidney disease. Itchy skin can occur anywhere on the body, but it commonly affects the back, legs, and arms. It is intensified by sweat, dry skin, and heat. While it may sound mild, this itchiness can be so intense and persistent that it can lead to a poor quality of life. When the pruritus is severe, the urgent need to scratch leads to more severe skin problems. Scratching may cause scrapes, or excoriations, on the skin, thicken, leathery skin, or skin lichenification, or raised bumps, or prurigo nodularis. Ongoing scratching can cause lesions to bleed, and a compromised skin barrier becomes an easy way for bacteria to enter and lead to more severe infections. Are you enjoying our video so far? If so, please give us some hints by dropping a like and we'll make more content like this. 2. Rashes. Rashes are also a common skin sign in people with kidney damage caused by poor elimination of toxins that build up in the skin. Acquired perforating dermatosis is a type of rash that appears in individuals with end-stage kidney damage in the form of small, pigmented, itchy bumps with a scaling center. These bumps can usually be found on arms and legs. Less commonly, they may be found on the trunk, scalp, and buttocks. As the bumps heal, new ones can appear, creating lesions in multiple stages of healing which may join together to form larger patches. Although these rashes are often itchy, you should avoid scratching because it can lead to worsened skin conditions. 3. Blisters. Blisters may also occur in people with kidney damage. They often appear as fluid-filled sacs on exposed areas such as the backs of the hands, forearms, or, less often, on the feet and the face. Kidney damage is just one potential cause of blisters. Blisters can be caused by infections, medications, poor diet, and heavy alcohol intake. Blisters associated with kidney damage can vary in size and severity. They may be accompanied by other symptoms such as pain, redness, and swelling. Unfortunately, when blisters heal, they dry up and develop a crust that later peels away, usually leaving a scar and skin discoloration. Calcium deposits. Calciphylaxis is one of the most severe skin conditions associated with kidney damage. It occurs when calcium accumulates in small blood vessels, leading to painful sores and ulcers. It's a rare but serious condition that occurs in up to 4% of patients undergoing dialysis and requires immediate medical attention. The exact cause of calciphylaxis remains unclear, but several factors can increase the risk. High blood calcium levels. This often happens due to imbalances in calcium and phosphate. Dialysis. Long-term dialysis patients are more at risk. Obesity, higher body mass index, or BMI, can be a contributing factor. 4. Medications. Certain medications can impact calcium metabolism. Patients with calciphylaxis describe painful, pink or purple bumps or plaques that develop into deep, painful ulcers covered with black crusts, usually located on the abdomen, buttocks, and legs. Another type of calcium accumulation is represented by calcinosis cutis, which refers to calcium deposits under the skin. These are usually firm white nodules near joints that may break through the skin and release a white chalky discharge. Calcinosis cutis are usually not painful unless they are located in the fingers or toes. 5. Dry skin xerosis. Dry skin or xerosis is one of the most common skin signs of kidney damage. However, dry skin is nonspecific, as it can be caused by a number of conditions besides kidney damage. Dry skin occurs in 50 to 80% of individuals on dialysis, and here are a few common causes. 1. Poor hydration. 2. Decreased sweat gland activity. 3. High levels of vitamin A. 4. Long-term use of diuretics. 5. Xerosis. Usually occurs in those who have been dealing with kidney damage for a while and are on dialysis, which often causes skin to become dry, rough, and scaly. People with xerosis also experience tight skin that can easily crack, leading to exposed entryways for bacteria. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 6. Swelling. The kidneys have many functions, one of the most important ones being the elimination of excess water and salt from our bodies. If your kidneys are damaged, water and salt may not be eliminated properly, leading to a buildup of fluid. This water and salt retention causes swelling and puffiness, especially in the hands, feet, and face. If your legs feel puffier than usual, press them with your finger to see if it leaves an indentation, called pitting edema. If you experience swelling and puffiness, you should see your healthcare provider to have your kidney function evaluated. 7. Changes in skin color. The presence of kidney damage can lead to a buildup of waste products in your bloodstream, which may cause your skin to change color, often with gray or yellow hue. This discoloration results from the toxins that are not being filtered and excreted in the urine. Skin hyperpigmentation may also occur as a result of a buildup of melanin, and it may be seen as a dark brown color. Skin pallor, or paleness, is commonly observed in individuals with chronic kidney disease caused by anemia. Another skin discoloration related to kidney damage is uremic frost. A white, powdery substance left on the skin's surface after sweat dries. Excessive scratching may also change the color or texture of your skin. 8. Nail disorders. Many medical conditions can cause nail changes, including kidney disorders. In a study of 100 patients, nail changes were found in 60% of individuals with CKD. In another study of 101 patients with severe renal disease who were on dialysis, hair, mucosal, and nail disorders were found in 23–45% of the patients. On your finger or toenails, you may notice one white transverse band, called Mees line, or multiple bands, called Morch's lines. These can appear in people with kidney damage due to stress or low protein levels in their blood. Another frequent finding is the half and half nail disorder, also known as Lindsay nails, characterized by a brownish color at the top of the nails from increased melanin and a white or pink color at the bottom of the nails due to an increased number of small blood vessels. Less common changes are splinter hemorrhages, which are small red or brown lines under the nails that resemble splinters. They can be a sign of underlying health issues, including kidney damage, and they are caused by small blood clots that damage the capillaries under the nails. Keeping nails trimmed and moisturized can reduce the risk of nail disorders. 9. Hair disorders. One of the most troubling symptoms for individuals with kidney damage is hair loss. This condition, medically known as alopecia, can have an impact on self-esteem and quality of life. Hair loss can result from several factors associated with kidney disease. Notes 1. Nutritional deficiencies. Kidney damage often leads to imbalances in essential vitamins and minerals, such as iron and zinc, which are critical for healthy hair growth. 2. Hormonal imbalances. The kidneys regulate many different hormones that affect hair growth. When the kidneys are not working properly, it can lead to hormone dysregulations which can affect hair growth cycles. 3. Medications. Some of the medications prescribed for kidney disease, including certain blood pressure medications and immunosuppressants, can contribute to hair thinning and loss. Dehydration and dialysis treatment can strip hair of natural oils, making it more dry and brittle. It is important to remember that hair loss and hair shedding can occur from a variety of medical conditions. If you are experiencing a sudden increase in hair shedding or patches of alopecia, see your healthcare professional to help determine the cause. What can you do? We covered many skin signs, some more severe that would make us call our doctor, and other more common ones that may not necessarily be related to kidney damage. So, the question that follows is, when to seek medical help, and who to consult for these symptoms? As this video shows, some skin symptoms are more specific or serious, and clearly require a visit to a healthcare provider. But what do we do about those less alarming symptoms that we might ignore or confuse with other causes? Kidney damage affects many people, but there are some risk factors for kidney disease that you should consider when you notice skin changes. If you are over 60 with other conditions such as high blood pressure, diabetes, or obesity, pay close attention to your skin and nail changes, even seemingly ordinary ones. You should contact your primary care doctor at any sign of skin changes. Blood and urine tests will help diagnose kidney problems, allowing you to start proper treatment recommended by a nephrologist or kidney doctor. You must communicate well with your doctor, who can explain your condition and how to prevent further skin changes. If you have severe or persistent skin symptoms, you should see a dermatologist or skin doctor who can collaborate with your nephrologist. How can I manage these symptoms by myself? After being diagnosed, you should initiate proper treatment, but you should not rely only on medication. Our lifestyle and day-to-day practices play a key role in the healing process. For you need to make important changes to manage kidney damage. These changes include 1. Diet and nutrition. Eating a balanced, kidney-friendly diet is important for your skin health. Monitor your salt, protein, phosphate, and calcium intake. Quit smoking and limit or avoid alcohol consumption. Search for new recipes or talk to a nutritionist who can recommend dishes based on your favorite flavors. 2. Hydration. Drinking enough water can help keep your skin hydrated and reduce dryness. However, if you have kidney issues, especially if you are on dialysis, overhydration can lead to fluid buildup. To manage thirst when restricting fluids, eat pieces of frozen fruit, drink small sips, or rinse your mouth with mouthwash. Consult your healthcare provider to determine your ideal water intake. 3. Moisturizing. To combat dryness and itchiness, moisturize your skin at least once a day. Use fragrance-free hypoallergenic moisturizers to avoid irritation. Emollients that contain salicylic acid or urea and a gentle skincare regimen can be useful. 4. Avoiding hot showers and baths. Hot showers can strip your skin of its natural oils, making it dry and itchy. Avoid long baths and try taking short showers with lukewarm water. 5. Avoiding harsh skincare products. Avoid using harsh soaps and skincare products that can irritate your skin. Stick to gentle, fragrance-free products designed for sensitive skin. 6. Sun protection. Sun damage can worsen skin problems, especially if your skin is sensitive. Use sunscreen with at least SPF 30 to protect your skin, even on cloudy days, and reapply it throughout the day. 7. Comfortable clothing. Wear loose-fitting, comfortable clothing made from natural fibers like cotton. This can help prevent irritation and allow your skin to breathe. 8. Regular checkups. Regular checkups are essential for monitoring your kidney function and overall health. Discuss any new symptoms or concerns with your doctor during these visits. What is the most important takeaway from this video? When it comes to kidney health, recognizing skin signs is crucial for early diagnosis and effective management. Kidney damage often causes specific symptoms like itchy skin, rashes, blisters, and calcium buildup in vessels and skin. It can also lead to nonspecific signs such as dry skin, swelling, changes in skin color, nail and hair disorders. Each of these symptoms signals potential underlying renal problems. Itchy skin, for example, affects 90% of people on hemodialysis due to the buildup of waste products like urea. Similarly, rashes, blisters, and calcium deposits signal that the kidneys struggle to eliminate toxins effectively. Although less specific, nail and hair disorders should not be ignored, especially in those with associated risk factors, as they can signal deteriorating kidney function. People with kidney disease should watch for these symptoms, especially if they are at high risk, due to factors like age over 60, diabetes, high blood pressure, or obesity. Early detection can significantly improve treatment outcomes. Seek immediate medical help when these signs appear. Blood and urine tests will confirm the diagnosis and pave the way for proper treatment, often involving collaboration between a nephrologist and dermatologist. Managing these symptoms involves more than just medical treatment. Lifestyle changes play a crucial role. These include maintaining a balanced diet, staying hydrated without excess, using gentle skincare products, avoiding hot showers and harsh soaps, and ensuring proper sun protection. Such changes can greatly improve your quality of life and skin health. In conclusion, recognizing and addressing skin signs linked to kidney damage on time helps diagnosis and management of the condition. Adopting a proactive approach helps manage the symptoms and improves overall kidney health and quality of life. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Have you seen any signs from our video or worried about kidney disease? Your kidneys might need a natural boost. See you again. Stay informed. Stay healthy. Essential 12 vitamins to manage diabetes effectively. Diabetes, characterized by the body's impaired ability to regulate blood sugar levels due to insulin resistance, can lead to elevated sugar and insulin levels in the bloodstream. This condition significantly increases the risk of severe health complications such as nerve damage, vision impairment, ocular issues, cardiovascular diseases including heart attacks and strokes, and irreversible kidney damage. For individuals grappling with prediabetes or diabetes, it's crucial to be aware of the vital vitamins and minerals necessary for mitigating these health risks. In our discussion today, we will delve into these essential nutrients. It's important to note that when I refer to vitamins in this context, the term is used in a broad sense, encompassing not just vitamins, but also antioxidants, minerals, and phytonutrients. These components are fundamental in safeguarding your body against the harmful impacts of diabetes. This comprehensive approach to diabetes management is key in maintaining overall health and preventing the progression of the disease's complications. Let's begin with benfotiamine, a lipid-soluble derivative of vitamin B1. I recommend a dosage of 300 mg twice daily to address and potentially reverse nerve damage due to elevated blood sugar levels. Benfotiamine is particularly beneficial for individuals experiencing nerve pain, tingling, numbness, and eye disorders, as well as those with high blood pressure or kidney issues. It enhances the efficiency of mitochondria, the cell's energy generators, thereby aiding in nerve healing and repair. Moreover, benfotiamine serves as an antioxidant, safeguarding arterial walls from damage caused by high blood sugar, consequently reducing heart disease risk. To complement this, I advise incorporating foods rich in vitamin B1 such as nutritional yeast, organic pork, wild salmon, flax seeds, and sunflower seeds into your diet. Next, let's discuss potassium, a crucial mineral often underconsumed. Diabetics, in particular, need at least 700 mg daily. Potassium-rich foods include leafy greens, berries, avocados, beet tops, bok choy, cabbage, and Brussels sprouts. This mineral enhances insulin sensitivity, aiding in blood sugar regulation. For an additional intake, consider 1,000 mg of potassium citrate in powdered form, mixed in water, taken twice daily. Thirdly, alpha-lipoic acid, ALA, at a dose of 600 mg up to 3 times daily, is effective in diabetic neuropathy. Prescribed in Germany for its antioxidant properties, ALA alleviates pain and tingling sensations in extremities. It improves nerve blood flow and supports nerve healing from oxidative stress, while aiding in signal transmission. To obtain ALA naturally, incorporate high-quality organ meats like beef liver, cod liver, and pasture-raised beef into your diet. These strategies are instrumental in managing diabetes and preventing its complications. Let's come back for extra virgin cod liver oil. Omega-3 fatty acids, particularly DHA, are crucial for nerve, blood vessel, and brain health. DHA, abundant in the brain, is vital for the formation of new neurons and nerve cells. Sources of DHA include fatty fish like wild salmon, sardines, anchovies, and mackerel. The most concentrated natural source, however, is Icelandic virgin cod liver oil, recommended at about 1 teaspoon per day. Omega-3 fats, with their anti-inflammatory properties, aid in healing inflammation and enhancing insulin sensitivity, thereby lowering blood sugar levels. Next is chromium picolinate. This trace mineral, required in minute amounts, 25 to 35 micrograms daily, is particularly beneficial for diabetics. It enhances the sensitivity of glucose and insulin, aiding in the removal of excess sugar from the blood. This process protects the endothelial layer and arteries and reduces oxidative damage to vital organs. Chromium supplementation may also reduce cravings for sugary foods by satisfying cellular energy needs. Moving to coenzyme Q10, this fat-soluble, anti-aging molecule is significant for diabetes or cardiovascular health. Found in high concentrations in the heart, liver, kidneys, and other organs, it protects cell membranes from sugar-induced damage and maintains cellular energy production. Diabetics, often having higher blood glucose levels than their mitochondria can manage, may experience oxidative damage. Supplementing with 300 milligrams of coenzyme Q10 in the form of ubiquinol daily, along with consuming organ meats, fatty fish, cauliflower, and broccoli, can be protective. Number 8. The B vitamin complex is critical, especially vitamins B6 and B12, for nerve health and diabetes. These vitamins aid in forming myelin, the protective sheath around nerves. While supplements with methylated B vitamins are available, a natural source is nutritional yeast flakes, which can help alleviate nerve pain, boost energy, and maintain brain function. The eighth key nutrient is soluble fiber. When consumed, vegetable fiber nourishes the beneficial gut bacteria, which in turn produce butyrate, a substance that reduces insulin resistance. Studies have demonstrated that diets high in soluble fiber enhance insulin sensitivity, lower blood sugar levels, and improve cholesterol profiles in individuals with type 2 diabetes. This can also aid in combating obesity. Excellent sources include chia seeds, avocados, basil seeds, raspberries, asparagus, and artichokes. Additionally, cognac fiber supplements, taken with ample water, form a gel that supports the digestive tract, further aiding in managing blood sugar levels. Number 9. We have vitamin D. Stress, known to elevate blood sugar levels, is partly managed by cortisol. Vitamin D regulates cortisol production, aiding in stress reduction. It also supports insulin release from the pancreas, helping to maintain blood sugar control. It's beneficial for mood enhancement, inflammation reduction, and immune system strengthening. Although your body produces vitamin D through sun exposure, supplementing with 10,000 international units of vitamin D3, along with 100 micrograms of vitamin K2, is recommended. The 10th nutrient is zinc, crucial for eye health and diabetics. High blood sugar can damage the retina, leading to issues like blurry vision. Adequate zinc intake 8 mg for women and 11 mg for men daily can help prevent retinopathy. Zinc also plays a role in preventing diabetic necrosis, particularly in the feet, by boosting glutathione production. 11th is acetic acid, found in apple cider vinegar. It enhances stomach health, aiding in the absorption of nutrients, including those mentioned in this discussion. Consuming a tablespoon of apple cider vinegar and water before meals can help control blood sugar, support metabolism, and promote healthy weight loss. Lastly, magnesium is vital. Involved in numerous biochemical reactions, it's essential for DNA synthesis and muscle contraction. Over half of Americans may not meet their daily magnesium needs, and a deficiency can exacerbate insulin resistance. Notes incorporating magnesium-rich foods like unsweetened dark chocolate, avocados, pumpkin seeds, and sunflower seeds, or taking supplements like magnesium citrate or glycinate, can help manage diabetes symptoms. In summary, these nutrients and vitamins play a pivotal role in protecting the body from the detrimental effects of high blood sugar and insulin. As a health expert, it's crucial to integrate specific nutrients into your diet, many of which are found in everyday foods. Here are some lifestyle strategies to counteract insulin resistance and diabetes. 1. Redefining your diet. Eliminate refined carbohydrates, sugars, grains, and flour-based products like bread, pasta, cereal, and sugary drinks. These spike blood sugar levels. Opt instead for healthy fats and proteins such as avocados, pasture-raised eggs, extra virgin olive oil, raw coconut oil, and grass-fed meats. 2. Vegetable intake. Consume 5 to 10 cups daily of organic, raw, leafy greens and cruciferous vegetables like kale, collard greens, broccoli, Brussels sprouts, cabbage, cauliflower, along with tomatoes and onions. These are rich in soluble fiber, enzymes, vitamins, and minerals that help reverse insulin resistance. 3. Intermittent fasting. Adopt the pattern of eating all your daily calories within a 4-hour window and fasting for the remaining 20 hours. This approach enhances cellular insulin sensitivity. If hunger is an issue, supplement with 1 to 2 tablespoons of MCT oil after your first meal to increase satiety and ketone levels. 4. Eliminate unhealthy fats. Avoid vegetable oils like margarine, soy, cottonseed, canola, rapeseed, and corn oils. These contribute to diabetes and insulin resistance by damaging cells in the pancreas. Replace them with healthier fats mentioned earlier. 5. Incorporate anti-diabetic herbs and spices. Use cinnamon, garlic, turmeric, ginger, gymnema, and berberine. These natural agents support insulin production and glucose uptake into cells. Drinking matcha green tea is also beneficial for blood sugar control. 6. Stress management and sleep. Control stress through activities like walking in nature, which can reduce cortisol levels. Aim for at least 8 hours of sleep per night to normalize hormones and manage stress. Incorporating these lifestyle changes along with the nutrients discussed can significantly mitigate the effects of diabetes and aid in reversing insulin resistance. To learn more about this topic, please like the video and subscribe to my Healthy Care channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Your diet is more than just fuel to keep your body running, it provides the essential building blocks for your cells. Indeed, the saying "you are what you eat" is not merely a cliché. This is particularly true for those suffering from kidney disease. In the U.S., kidney disease affects about 37 million people, which represents 15% of the adult population. More than 1 in 7 adults have kidney disease, and approximately 90% of them are unaware of their condition. Approximately 80 million American adults, or 1 in 3, are at risk for kidney disease. The possibility of having kidney disease without knowing it can be quite alarming. However, making a few dietary changes and avoiding certain foods can greatly improve kidney protection. Before you swap out the ice cream in your fridge for green vegetables, make sure to subscribe and hit the notification bell so you never miss an update from us. Support Healthy Care by watching this video to the end. Now, let's dive into the 15 foods you should avoid for healthier and happier kidneys. 1. Peanut butter. Peanut butter on bread may seem like a tasty and healthy choice, but is it truly beneficial? Peanut butter contains high levels of phosphorus, which, in excessive amounts, can be harmful to your body. For those with kidney issues, this is particularly concerning because weakened kidneys cannot effectively remove phosphorus from the blood. This excess phosphorus then draws calcium out of your bones, weakening them and increasing the risk of fractures. It might be wise to moderate your peanut butter consumption. 2. Junk food. While it's hard to resist the occasional craving for pizza, burgers, French fries, or onion rings, indulging in junk food could be detrimental to your health. A recent study has indicated that a diet predominantly consisting of junk food can lead to blood sugar levels comparable to those seen in type 2 diabetes. Such dietary habits can cause long-term damage to your kidneys and potentially trigger diabetic kidney disease. It might be best to cut back on these foods for the sake of your kidney health. 3. Shellfish. Shellfish, including clams, lobsters, crabs, and shrimp, are known for being excellent sources of protein. However, research has uncovered that a toxin called domoic acid, found in shellfish and some fish that consume algae, can damage the kidneys. Alarmingly, even minimal exposure to this toxin can be harmful. If you have kidney disease, it may be wise to avoid shellfish to protect your kidney health and steer clear of your favorite seafood restaurant. 4. Pickled foods. Pickled foods are generally a favorite for many, but they are also loaded with sodium. When your kidneys are compromised, they struggle to eliminate excess sodium and fluid from your body. 5. Eat healthy. This buildup can lead to several issues such as swollen ankles, puffiness, increased blood pressure, shortness of breath, and fluid accumulation around your heart and lungs. Canned soups. Soups are often viewed as a healthy option, but don't be deceived by canned varieties, even those labeled as low sodium. These products tend to be high in potassium, which can be problematic for those with kidney issues. Weak kidneys struggle to remove excess potassium from the blood, leading to a buildup that can cause symptoms such as nausea, weakness, numbness, and a slow pulse. It's important to look beyond the labels and consider the overall nutrient profile when choosing canned soups. 6. Processed foods. It may seem like a good idea to grab those seemingly healthy granola bars or slices of brown bread every day, but if you have kidney disease, you might need to reconsider. Processed foods such as potato chips, cookies, deli meats, bread, and cheese are significant sources of sodium and phosphorus additives, both of which can have damaging effects on the kidneys. While an occasional bag of potato chips is fine, moderation is key to managing your intake of these harmful additives. 7. Red meat. A juicy steak or a succulent rack of lamb might be hard to resist, but excessive consumption of these red meats can be particularly harmful for those with weakened kidneys. These meats are high in protein, and when you consume protein, your body breaks it down into waste products that the kidneys must filter from the blood. Eating more protein than your body requires can place additional strain on your kidneys, potentially causing kidney function to decline at a faster rate. 8. Chocolate. Chocolate is a beloved treat for many, but it also contains unhealthy fats that can heighten the risk of heart attacks or strokes, particularly for individuals with chronic kidney disease, CKD. Those with CKD are already more vulnerable to cardiovascular issues compared to the general population. Navigating the balance between enjoying your favorite foods and adhering to dietary restrictions necessary for your health condition can be challenging. 9. Sugar. Most people are aware of the harmful effects of sugar on various parts of the body, but it may surprise you to learn that sugar does not directly affect the kidneys. However, before you reach for that bag of candy, it's important to understand that sugar contributes to the development of diabetes, a condition that significantly increases the risk of kidney failure and can exacerbate kidney damage if the kidneys are already weakened. This indirect effect makes sugar a critical dietary consideration for kidney health. 10. Soda and cola drinks. There's nothing quite like the refreshing sensation of a cold, fizzy soda on a hot day. However, recent research has shown that consuming at least 2 carbonated beverages daily is linked to increased protein excretion in the urine. A key indicator of kidney dysfunction, regular intake of soda or other carbonated drinks may also lead to hypertension and diabetes, both of which can further impair kidney function, lead to kidney failure, and promote the formation of kidney stones. It might be time to consider replacing those sodas with water or natural, healthy juices. 11. Alcohol. For healthy individuals, the kidneys are constantly active, filtering and managing bodily wastes. However, if you have kidney disease, your kidneys are already working harder than usual to maintain normal function. Consuming alcohol under these conditions can overwhelm your kidneys, preventing them from effectively filtering out dangerous levels of waste from your blood, which can be life-threatening. It's important to avoid binge drinking, especially during events like a college reunion, to protect your kidney health. 12. Milk. Milk is often touted for its health benefits, but it might not be the best choice for your kidneys. Milk contains high levels of phosphorus, potassium, and calcium. When your kidneys are compromised, they struggle to filter out these minerals, leading to their accumulation in your blood. This buildup can have serious, potentially fatal consequences if not managed properly. It might be wise to enjoy that cookie without a glass of milk if you have kidney issues. 13. Avocado. Avocados are a staple in many health-conscious diets, celebrated for their numerous benefits. However, for those with kidney issues, avocados come with a significant caveat due to their high potassium content. When kidneys are not functioning properly, they struggle to remove excess potassium from the body, leading to dangerous levels of buildup. If you have kidney disease, it may be prudent to cut back on avocado toast to keep your potassium levels in check. 14. Salt. Salt is essential for flavoring our meals, but it's primarily composed of sodium, which can be harmful in excess. Consuming too much sodium causes the body to retain fluid, leading to an increase in blood pressure and additional strain on the kidneys. While a pinch of salt can enhance the taste of food, it's important to use it sparingly to avoid overburdening your kidneys. Moderation is key when it comes to salt intake, especially for those with or at risk for kidney issues. 15. Butter. Butter is high in saturated fats, which can raise blood cholesterol levels and increase the risk of heart disease and stroke, especially for those with existing kidney issues or chronic diseases. Instead of completely eliminating butter from your diet, consider using it in moderation and opting for healthier vegetable oils like olive oil or canola oil. This approach not only reduces your intake of saturated fats, but also contributes to a balanced diet and protects your cardiovascular and renal health. A little awareness and knowledge about the ingredients in your food can significantly contribute to healthier and happier kidneys. Was this video an eye-opener for you? Did you realize that some foods, while generally healthy, might be harmful to those with kidney disease? Share your thoughts in the comments section below. If you enjoyed this video, don't forget to hit like, share, and subscribe to my channel. Today, we're going to talk about how to look younger. And so in 6 months, I'm going to have my birthday and I'm going to be 40. Okay. So I'm going into the 40s pretty scary because that's kind of old. I've been 39 for over a year. I guess it's time to graduate. And I'm being super sarcastic because I'm not 39. I'm actually 59 and 6 months. I'll be 60 and it's kind of weird because 60 seems like you're old. But I don't feel old. I don't feel 60. I feel probably 32. And I remember I was in practice. I did a lot of seminars. And one of the seminars I did was in an assisted living home. There was a patient who lived there. She'd come to see me. And she says, "Would you come to my assisted living home and do a seminar?" So I did. When I got there, there was a room full of people that looked really old. Some of those people in that room were in their 60s, and looking back on it, I'm like, that's mind-blowing to actually go into an assisted living home when you're 60. I can't wrap my wits around that. That's just wild. Apparently some people age faster than others. Today, we're going to talk about how to reverse that whole process. The number one anti-aging mistake that so many people make, and that is to avoid the sun and wear sunblock 365 days out of the year. I mean, think about it. Human beings have evolved for eons being exposed to the sun. And now we're supposed to live in the darkness. Why are they telling people to avoid the sun? Because of something called ultraviolet radiation. Okay, UV. And it basically makes up only 3% of all of the wavelengths. 37% is the visible light spectrum. And then we have nearly 60% infrared. Infrared is super therapeutic to your body. Some people have infrared machines, but you can get infrared for free from being in the sun in the early morning and also in the late afternoon. So, regarding the review, there's different kinds of UVA that can very easily go through the clouds. So, even if it's a cloudy day, it's going through. There is some association with those rays as well as the aging of your skin. There's melanin, which is a pigment that's a natural sun blocker that's going to create a tanning effect if you're in the sun repetitively. Now UVB has everything to do with making vitamin D. What's really interesting about these sun blockers is that they mainly block out the UVB. They don't really make them filter out that UVA. You know, the rays that affect aging. And when your skin gets enough, you're going to notice the skin's going to get hotter. Basically telling you it's time to go in the shade. UV is dangerous. If you're going out in the sun and getting burned and you're doing that repetitively, even the UVA radiation has some benefits. It can increase something called nitric oxide that increases blood flow, that increases circulation to the skin. People have this question about what about skin cancer? Okay, melanoma. What's interesting about melanomas is that we've been decreasing the amount of sun exposure for quite some time. But melanoma has been increasing by a factor of 3,000%. Also, melanoma skin cancer usually occurs in areas that are not exposed to the sun. Is it really the sun that's causing melanomas? Or could it be related to a lack of vitamin D? Also BDNF. This is something that is in the brain, and BDNF actually increases with exposure to the sun. And so when you're getting exposure to the sun, you're getting a lot of melatonin in the cells. And that's a very powerful antioxidant. However, in the winter, many places around Earth do not allow you to get in the UV radiation to make vitamin D. If you're trying to get vitamin D through your window, your glass window, you're not going to get vitamin D. It gets filtered out. So this idea that the UV is so bad for your skin is completely not true. Other advice that you're told to make your skin look youthful is to use a good moisturizer. I hope you're reading the ingredients on these moisturizers because they are filled with just tons of chemicals. They start drying out the skin because of the alcohol and the mineral oil that pulls out the fat-soluble vitamins from your skin. When you put this stuff in your skin, it gets absorbed into the bloodstream and it ends up in your liver, consuming synthetic antioxidants that can create more problems on your skin. Consuming sugar. It's going to age the skin very fast. Another thing you have to be careful about is overwashing your face with soap. Some people think that they have to wash their face with soap every day and all that detergent is very harsh on the skin. It's going to age the skin mainly because you have a microbiome, good bacteria around your skin. You don't want to get rid of that chlorine and tap water, which is very harsh on your skin. You want to get a filter on your shower. And the last thing I'm going to talk about is antibiotics. They create some serious problems with your skin, not just talking about just antibiotics that you have taken. I'm talking about other things that act like an antibiotic, birth control pills and acids. Those are for acid reflux, steroids, statins. Okay, now this next part is fascinating. There is a hormone that can increase the stem cells for your skin and just making your skin look awesome. Stem cells are undifferentiated. They haven't really turned into anything. And those stem cells are triggered by oxytocin. Now, wait a second, oxytocin, they call it the love hormone, but they really should call it the health hormone because it has huge regenerative properties. It creates all sorts of cool effects that help people, bond. To be more social, to feel more calm. How do we increase oxytocin? I did a video on this and there's a lot of ways to increase it, but the one that I'm going to talk about is just really cool. And that is basically taking a very specific microbe. Okay. And growing it in a culture that ends up looking like yogurt. What you have to realize is when you destroy the microbiome, whether it is taking an antibiotic or some other way, there are certain microbes that end up never coming back. And one of the key microbes that doesn't come back is called. And so this microbe that's been lost in 96% of the population because of the antibiotics and the other effects needs to be reseeded. It has an effect on wound healing, which is wild. L-redurie in large amounts, 300 billion quantities that you'll make in a yogurt maker, and you can take a half a cup of this at night. I've been taking it for about 3 weeks and I have to say, my sleep is incredible. I feel incredibly low stress. The next thing is cold immersion on your face. Now whether you have a cold immersion tank or just a bucket of ice water and you put your face in it for let's say 10 seconds or even less than that. That is super healthy for rejuvenating your skin on your face. It's going to increase blood flow. It's going to tighten the pores. It's going to stimulate collagen. I mean, you're just going to have to test it out. And of course, exercise is very, very important for anti-aging, especially of your skin. And lastly, facial exercises can make you look young as well. And these involve all sorts of myofascial stretches because we really don't exercise the face muscles. And on that note, thanks for watching. And I will see you in the next video. Welcome to my channel, where we'll be discussing the top 10 medications that cause liver damage. The liver plays a crucial role in filtering and processing harmful substances in our bodies. However, certain medications can lead to severe liver damage, and it's important for us to understand them to protect our liver health. In this video, we'll delve into these medications and provide information on the early symptoms of drug-induced liver damage. The last one is the main one, so stay until the end. This will help you recognize and respond promptly to any signs related to your liver health. The 10th medication on our list is the combination of amoxicillin with clavulanate, a widely prescribed antibiotic known for its effectiveness in treating various infections like sinusitis, tonsillitis, pneumonia, and urinary tract infections. Despite its efficacy, there's a significant concern associated with this medication. It has been linked to numerous cases of acute liver injury, a serious condition characterized by sudden liver damage that can have severe consequences if not promptly addressed. Therefore, it's crucial for healthcare professionals to be mindful of this risk when prescribing orclavulinate. Patients should be closely monitored, especially if they're using the medication for prolonged periods or in high doses. They should also be educated about the signs of liver injury and advised to seek immediate medical attention if they experience symptoms such as jaundice, dark urine, extreme fatigue, nausea, vomiting, or abdominal pain, as these may indicate liver problems requiring urgent intervention. The ninth medication known to potentially harm the liver is diclofenac. While all anti-inflammatories, like ibuprofen and naproxen, carry a slight risk of liver damage, it's relatively rare. However, diclofenac is particularly notable for its higher risk compared to other anti-inflammatories when it comes to causing liver injuries. Liver damage from diclofenac can occur weeks or even months after starting to use the medication. Hence, it's crucial to understand that diclofenac not only affects the kidneys but also poses a risk to the liver. Stay vigilant about any symptoms and consult a healthcare professional if you experience any concerns while using this medication amiodarone, also known as ankerone. This medication stands out for its effectiveness in significantly improving arrhythmias and even clearing 24-hour Holter records. However, it's essential to recognize that amiodarone carries one of the highest indexes of side effects among medications. It can impact various organs, including the thyroid, lungs, skin, and yes, the liver as well. Due to this extensive range of potential side effects, its usage has become more restricted compared to the past, reserved for specific cases where the benefits outweigh the risks. While amiodarone typically doesn't cause acute liver injury, it's important to note that its harmful effects on the liver may take weeks to months to manifest. Healthcare professionals and patients alike should remain vigilant for any signs of liver problems while using this medication and report any concerns promptly to their healthcare provider. The seventh group of medications that can potentially affect your liver are anticonvulsants. Specifically, medications like phenytoin, commercially known as Hydental, and valproic acid, known as Depakote, are noteworthy for their association with liver damage. Hydental has been observed to start causing liver injury immediately after initiation of treatment, while the effects of Depakote may become apparent between 1 and 6 weeks into therapy, underscoring the importance of regular monitoring of liver enzymes. In addition to these, carbamazepine and lamotrigine are also recognized for their potential to cause liver injuries, although such occurrences are much less common. Thus, individuals prescribed these anticonvulsant medications should be vigilant about any signs of liver dysfunction and ensure regular liver function tests to monitor their liver health closely. The sixth medication known to potentially cause liver injury is allopurinol, often prescribed for individuals with elevated uric acid levels or those suffering from gout, especially when dietary modifications alone aren't sufficient to manage the condition. Allopurinol effectively lowers uric acid levels in the body, thereby preventing gout attacks. However, it's crucial to understand that allopurinol can have adverse effects on the liver. Liver injuries associated with allopurinol use can occur rapidly, sometimes within days or weeks after initiating treatment. Hence, patients starting allopurinol therapy should undergo careful monitoring for any signs of liver damage. Regular medical follow-up is essential to promptly detect any issues and adjust the treatment plan as needed. Additionally, patients should promptly report any unusual symptoms that may arise during allopurinol use to their healthcare provider. Despite these risks, it's important to note that allopurinol remains a valuable therapeutic option for many patients with gout or elevated uric acid levels. However, its usage should be managed cautiously, with close attention paid to liver health. The fifth medication of concern is methotrexate, a widely utilized treatment for various conditions including rheumatoid arthritis, psoriatic arthritis, and certain types of cancer. One crucial aspect of methotrexate use is the necessity for continuous monitoring of liver enzymes due to the common occurrence of liver injury associated with this medication. Liver injury induced by methotrexate can span from mild to severe, and in severe cases, may result in significant liver damage if not promptly identified and managed. To mitigate these risks, healthcare providers typically conduct regular liver enzyme tests for patients on methotrexate. These tests serve to promptly detect any signs of liver damage, enabling adjustments in medication or treatment strategies to prevent major complications. Adhering to medical guidelines regarding methotrexate dosage and frequency of use is paramount in minimizing the likelihood of adverse effects, including hepatic ones. In certain scenarios, depending on the patient's health status and response to treatment, healthcare providers may explore alternative therapeutic options to mitigate the risk of liver injury associated with methotrexate. The fourth category of medications that can potentially impact the liver is antifungals. Specifically, fluconazole and itraconazole, commonly employed in the treatment of candidiasis and nail mycosis, are associated with hepatotoxicity in certain susceptible individuals. Given this association, it's crucial for individuals using these medications to treat mycosis to be vigilant about recognizing signs of hepatotoxicity. As mentioned earlier, prompt identification of such symptoms can facilitate timely intervention and management to mitigate the risk of liver damage associated with antifungal therapy. The third group of medications that can impact the liver are antipsychotics, specifically risperidone and quetiapine, marketed under the name Seroquel. These antipsychotic medications are not only utilized in the treatment of psychoses but are also employed for cases of refractory depression, which refers to depressions unresponsive to conventional treatment. Both risperidone and quetiapine carry the potential to cause liver damage, primarily through a process known as drug-induced cholestasis. This condition occurs when there's an interruption or reduction in the flow of bile from the liver, crucial for fat digestion and waste elimination. When medications like risperidone and quetiapine interfere with this process, bile can accumulate in the liver, leading to potential hepatic damage. Therefore, patients undergoing treatment with these medications should undergo careful monitoring for any signs of liver problems to ensure early detection and intervention. The second medication known to potentially affect the liver is methyldopa. Methyldopa is commonly prescribed to manage high blood pressure and is particularly favored for its safety, being the most prescribed medication for pregnant women with hypertension. Despite its overall safety profile, methyldopa has been associated with potential liver damage. As such, its use is not recommended for individuals with pre-existing liver conditions such as fibrosis or cirrhosis. It's important to note that adverse effects on the liver can manifest up to 12 weeks after initiating treatment with methyldopa. Regular monitoring of patients using this medication is crucial to promptly detect any signs of liver impairment. This monitoring helps prevent deterioration and ensures that hypertension treatment does not inadvertently harm liver health. Patients with a history of liver diseases should engage in discussions with their healthcare providers to explore safer alternative treatment options. The top drug on the list is paracetamol, which is widely recognized as the leading cause of drug-induced liver failure. Typically, liver injury isn't triggered by the standard dosage, but rather by excessive doses. Unfortunately, due to its widespread availability, some individuals misuse paracetamol, taking more than the recommended amount. For instance, instead of adhering to the appropriate dosage for a headache, they might ingest 3 tablets at once, repeating this overdose pattern. It's crucial to underscore that when taken as directed, paracetamol is safe. Doctors routinely prescribe it to infants to alleviate fever or pain without encountering issues. However, surpassing the recommended dose can be perilous. Shockingly, more than a third of liver failure cases attributed to medications are linked to paracetamol. An overdose of paracetamol can precipitate acute liver failure, which carries a high mortality rate and often necessitates a liver transplant if the organ fails to regenerate itself. Unlike the kidneys, where hemodialysis can sometimes reverse renal failure temporarily, the liver typically requires a transplant once compromised. Moreover, factors like alcohol consumption, genetic predisposition, and concurrent intake of other medications on the list can heighten the risk of liver injury. Liver damage from paracetamol typically initiates within 1-3 days following ingestion, with symptoms manifesting 2-4 days later. Fortunately, an antidote for paracetamol overdose exists: acetylcysteine, also known as Fluimucil, which serves as an expectorant and is used for certain cases of OCD and trichotillomania. This antidote proves effective in safeguarding the liver against paracetamol overdose. However, if you've exceeded the recommended dosage, it's imperative to seek immediate medical attention at an emergency room and explain the situation to the doctor, rather than risking the need for a liver transplant. It's essential to recognize that just because a medication isn't listed here doesn't mean it can't cause liver damage. Vigilance and adherence to prescribed dosages are paramount to protecting liver health. The roster of medications carrying hepatotoxic potential is expansive, encompassing antiretrovirals, vitamins like niacin, various antibiotics, supplements, etc. And even herbal teas, a topic explored in a separate video. Given the liver's pivotal role in bodily functions, any malfunction can have far-reaching consequences. Thus, exercising extreme caution when using medications is paramount to prevent drug-induced hepatitis and, in severe instances, fulminant hepatitis. Fulminant hepatitis represents a grave complication affecting a notable fraction of individuals with acute drug-induced hepatitis, often characterized by symptoms like jaundice and yellowing of the skin. Shockingly, among these cases, only approximately 20% survive without the necessity of a liver transplant. This underscores the critical importance of vigilant medication use and prompt medical intervention to safeguard liver health and overall well-being. To learn more about this topic, please like the video and subscribe to my channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Welcome to our Bestie channel. Today, we're delving into a crucial topic: liver health. Did you know that what you eat can either be a friend or a foe to this vital organ? That's right. Some foods can be your liver's best pal, while others can wreak havoc on it, potentially leading to serious health issues. In this video, we're uncovering the secrets of liver-friendly foods. Ever wondered how simple additions like artichokes and beetroot juice can work wonders for your liver? Or why omega-3 and antioxidants are like superheroes for this hard-working organ? We've got all the answers. But hold on tight, because we're not just stopping at the good stuff. Oh no, we're also exposing the 4 villains lurking in your kitchen that spell disaster for your liver. Trust me, you'll want to steer clear of these troublemakers. Stick around till the end because we're revealing a shocking truth about one particular food item that flies under the radar but poses a grave threat to your liver. It's a silent killer, and you won't believe what it is. 1. Beetroot juice. Beetroot juice isn't just your average drink, it's a liver superhero. Packed with nitrates and antioxidants like beta-carotene, it's like a protective shield for your liver. These powerful components swoop in to fight off oxidative damage and squash inflammation in your liver cells, keeping them happy and healthy. But that's not all. Beetroot juice also kicks your liver into gear by ramping up the production of essential enzymes that help detoxify your body. It's like giving your liver a much-needed boost to keep things running smoothly. And hey, that's not all. The benefits don't stop there. Beetroot juice is a multitasker when it comes to your health. From boosting stamina to lowering blood pressure, it's a true powerhouse of goodness. So, next time you're looking for a refreshing drink that packs a punch, reach for some beetroot juice. 2. Artichokes. Packed with antioxidants like cinnamon and silymarin, they're like a protective shield for your liver. These powerful compounds swoop in to defend your liver against free radicals, keeping it safe from harm. But wait, there's more. Artichokes also work wonders for your liver by boosting bioproduction, lowering cholesterol levels, and even promoting the regeneration of liver cells. Talk about a multitasking veggie. If you want to reap the benefits of artichokes for your liver, try brewing up a soothing cup of artichoke tea. Simply boil a liter of water, toss in a teaspoon of dried artichoke leaves and let it steep for a few minutes. Then strain and sip on this liver-loving elixir up to 3 times a day. 3. Salmon. Packed with omega-3 fatty acids, especially DHA, salmon is like a protective shield for your liver. This healthy fat doesn't just taste good. It's loaded with antioxidants and anti-inflammatory properties that keep your liver in top shape. By munching on salmon regularly, you're not just satisfying your taste buds, you're also preventing the buildup of nasty stuff like cholesterol and triglycerides, which can spell trouble for your liver. When it comes to cooking salmon, keep it simple. Whether you're grilling, baking, or pan-searing, just make sure to leave the skin on. Why? Because that's where the omega-3 goodness is concentrated. To make the most of salmon's liver-boosting benefits, aim to include it in your diet at least 3 times a week. And if you're not a fan of salmon, don't worry, there are 3 sources out there that your liver will love. Like flax seeds, chia seeds, walnuts, tuna, sardines, and herring. 4. Purple grapes. Purple grapes are packed with a powerful antioxidant called resveratrol, especially in their seeds. This compound is a game changer for your liver, fighting inflammation and protecting it from damage. But that's not all. Purple grapes are also bursting with vitamin C, flavonoids, and anthocyanins, all of which team up to keep your liver in tip-top shape. Whether you snack on them raw, sip on organic grape juice, or take grapeseed extract supplements, including purple grapes in your diet is a smart move for liver health. And hey, don't forget about their buddies red fruits like strawberries, cherries, blueberries, and more are equally packed with these liver-loving antioxidants. 5. Garlic. Garlic packed with allicin, a mighty antioxidant compound. Garlic is like a superhero for your liver. It works wonders by slashing LDL cholesterol, the bad kind, and triglyceride levels in your blood, reducing the risk of fat buildup in your liver and boosting its overall health. But here's the kicker, there are super easy ways to up your garlic game and reap those amazing benefits. Ever tried garlic tea? Simply chop a clove of garlic and let it steep in hot water for at least 10 minutes. This process helps release even more allicin, maximizing its liver-loving effects. You can also use this garlic-infused water to cook various dishes, adding both flavor and health benefits to your meals. 6. Oranges. Oranges aren't just a tasty snack, they're flavonoids and carotenoids. Oranges are essential for liver health. These powerful components work together to fight inflammation, keeping your liver happy and healthy. To get the most out of oranges, Aim to munch on at least one raw orange a day or sip on 150 milliliters of natural orange juice. By doing so, you're not just nourishing your liver, you're also reaping a host of other health benefits that oranges have to offer. But wait, there's more. It's not just oranges that pack a vitamin C punch. Fruits like kiwi, acerola, pineapple, lemon, and tangerine are also rich in this essential nutrient, making them excellent choices for supporting liver health and providing your body with a wide range of beneficial nutrients. 7. Oatmeal. Oatmeal isn't just your morning fuel. Packed with beta-glucan, a type of soluble fiber, oatmeal is like a superhero swooping in to save the day. This fiber works wonders by reducing the absorption of fats and lowering LDL cholesterol levels, which in turn lowers the risk of fat buildup in your liver. But that's not all. Oatmeal doesn't just stop at liver health. It's also a powerhouse when it comes to strengthening your immune system and fighting inflammation, keeping your whole body in top shape. To make the most of oatmeal's liver-loving benefits, aim to consume at least 3 grams of beta-glucan daily, which is roughly equivalent to about 150 grams of oatmeal flakes. Whether you enjoy it hot or cold, sweet or savory, oatmeal is a versatile and nutritious addition to your diet. 8. Nuts. Nuts aren't just crunchy snacks, they're a powerhouse of goodness for your liver. Among them, Brazil nuts shine bright as stars of liver health, packed with omega-3 fatty acids and vitamin E. They're like a dynamic duo fighting inflammation and oxidative stress in your liver. These nutrients work together as a formidable team, shielding your liver cells from damage caused by pesky free radicals and preventing the buildup of fat in this vital organ. By munching on just 2 Brazil nuts a day, whether it's part of your morning routine or a convenient snack, you're giving your liver the support it needs to stay healthy and strong. 9. Broccoli. Broccoli isn't just a green veggie. It's a powerhouse of liver-loving nutrients. Packed with shrimperol, a potent flavonoid, broccoli is like a superhero for your liver. This compound fights inflammation with gusto, providing crucial protection against liver diseases like hepatic steatosis, hepatitis, and cirrhosis. But that's not all. Broccoli is also a fiber powerhouse, which means it helps to lower bad cholesterol levels by reducing the absorption of fats in your intestines. Plus, it's a champion at activating liver enzymes responsible for detoxification, keeping your liver in top-notch condition. 10. Avocado. Avocado isn't just a trendy toast topper, it's a nutrient-packed powerhouse with a lot to offer your liver. Loaded with carotenoids, tocopherols, omega-3 fatty acids, and a plethora of vitamins, A, B, C, and E, avocado is like a treasure trove of anti-inflammatory and antioxidant goodness, essential for keeping your liver happy and healthy. But that's not all. Studies suggest that regular avocado consumption may bring about a host of additional benefits, including weight loss, better control of blood sugar levels, and improvements in cholesterol profiles. By increasing levels of HDL cholesterol, the good kind, and reducing levels of LDL cholesterol and triglycerides, the bad guys, avocado helps lower the risk of developing fatty liver disease. However, like all good things, moderation is key. Despite its impressive health benefits, avocado is calorie-dense, so it's important to enjoy it in sensible portions to avoid overindulgence and potential weight gain. Incorporating avocado into your diet in small, balanced servings allows you to reap its nutrient-rich rewards without tipping the scales. 11. Coffee. Coffee isn't just your morning pick-me-up, it's a liver-loving elixir packed with antioxidants like caffeine. These antioxidants play a crucial role in shielding your liver from a range of diseases, including fatty liver, making coffee a standout beverage for liver health. But the benefits don't stop there. Research suggests that regular coffee consumption may even lower the risk of chronic liver diseases such as cirrhosis and fibrosis, while also providing a protective barrier against liver cancer. To make the most of coffee's liver-boosting properties, aim to enjoy 2 to 3 cups of black coffee per day, sans sugar. Adding sugar can be harmful to liver health and increase the risk of developing conditions like diabetes. Notes, so it's best to keep it simple. 12. Extra virgin olive oil. Extra virgin olive oil isn't just a kitchen staple, it's a golden elixir for your liver. Packed with polyphenol like oleocanthal, this oil is a powerhouse of anti-inflammatory and antioxidant goodness. These compounds work tirelessly to combat inflammation, reduce fat buildup in the liver, and enhance blood circulation, all essential for maintaining optimal liver health. To unlock the full benefits of extra virgin olive oil, simply incorporate a teaspoon, approximately 6.5 milliliters, into your daily routine. Whether you drizzle it over salads, use it for cooking, or simply enjoy it as a dipping sauce. This simple gesture can make a world of difference for your liver's well-being. 13. Green tea. Green tea isn't just a refreshing beverage, it's a powerhouse of health benefits for your liver. Packed with phenolic compounds, including epigallocatechin, green tea boasts remarkable antioxidant properties that are essential for liver health. These antioxidants work wonders by lowering levels of LDL cholesterol and triglycerides, preventing the accumulation of fat in the liver, and guarding against conditions like hepatic steatosis, or fatty liver. To reap the rewards of green tea, simply brew yourself 2-3 cups daily. Whether you prefer loose leaves, tea bags, or powdered varieties, there's a green tea option to suit everyone's taste buds. Just be mindful not to consume green tea immediately after meals, as it can interfere with the absorption of vital nutrients like iron, calcium, and vitamin C. Now, let's delve into the discussion of the 4 most detrimental foods for your liver. It's a fact that certain food choices can wreak havoc on liver health, particularly those that trigger inflammation or inflict harm on liver cells. Such dietary habits can significantly impair liver function, paving the way for potential long-term health complications. Among the top offenders for liver health are 1. Processed foods. Foods that are heavily processed and packed with unhealthy additives like preservatives, artificial colors, and high amounts of sugar and salt can wreak havoc on your liver. These ingredients can promote inflammation and contribute to fatty liver disease, ultimately impairing liver function over time. 2. Fried foods. Indulging in fried foods like French fries, fried chicken, and fried snacks on a regular basis can spell trouble for your liver. These foods are typically high in unhealthy fats and calories, leading to weight gain and an increased risk of fatty liver disease. Plus, the frying process itself can generate harmful compounds that are detrimental to liver health. 3. Sugary beverages. Sugary drinks like soda, energy drinks, and fruit juices with added sugars are a triple threat to your liver. They're packed with empty calories and excessive amounts of sugar, which can overload the liver and contribute to insulin resistance, fatty liver disease, and even liver damage over time. For alcohol. Perhaps the most well-known offender of excessive alcohol consumption is a major risk factor for liver damage and disease. Alcohol is metabolized by the liver, and over time, heavy drinking can lead to inflammation, fatty liver disease, alcoholic hepatitis, cirrhosis, and even liver cancer. It's crucial to limit alcohol intake and practice moderation to protect your liver's health. Avoiding or minimizing the consumption of these 4 worst foods for your liver is essential for maintaining optimal liver health and preventing the onset of liver-related conditions. Instead, focus on incorporating liver-friendly foods and adopting a balanced diet to support your liver's function and overall well-being. To learn more about this topic, please like the video and subscribe to my Bestie channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Top 5 vitamins. People with hypothyroidism should use hypothyroidism, a condition characterized by an underactive thyroid gland that fails to produce or release enough hormones, can lead to a range of troubling symptoms. These include a slowed metabolism, weight gain, heightened sensitivity to cold, hair loss, and numerous other issues. So, what exactly happens in your body when hypothyroidism sets in? As illustrated in the accompanying image, the thyroid gland, shaped like a butterfly, resides in your neck. Just in front of your windpipe, this small gland plays a crucial role in producing hormones that regulate various aspects of your metabolism, including digestion, heart rate, breathing, body temperature, bone health, and much more. When your thyroid malfunctions, either by producing too few hormones or none at all, a host of problems can arise. These include hair thinning, especially at the outer edges of your eyebrows, an intolerance to cold temperatures, and overall weight gain. You may also experience persistent fatigue and feelings of depression. Some individuals may notice the development of deep, vertical ridges on their nails. Left untreated, an underactive thyroid can progress to the formation of nodules and goiters, which manifest as lumps in the neck. In the worst-case scenario, untreated hypothyroidism can lead to life-threatening conditions as your body's internal organs slow down and lose their proper function. But why does the thyroid cease to function correctly? Research indicates that 90% of cases of hypothyroidism are due to Hashimoto's disease, an autoimmune disorder in which the immune system mistakenly attacks healthy thyroid tissue. This autoimmune response often originates from damage to the lining of the gut, allowing undigested proteins like gluten to enter the bloodstream. This triggers inflammation and an overactive immune response that mistakenly targets the thyroid as a threat, resulting in damage and inflammation within the gland itself. Another possible cause of hypothyroidism is inadequate liver function and filtering out toxins or a deficiency of essential nutrients in your diet, such as selenium or iodine. Today, we will delve into 5 vitamins, used broadly to include minerals and nutritional supplements, that can aid in the restoration of your thyroid gland and the re-establishment of a healthy hormone balance. Furthermore, we will explore simple lifestyle adjustments that address the underlying causes of thyroid issues. It is essential to note that when we refer to vitamins, we are encompassing minerals and dietary supplements that can help mend your thyroid gland. To begin, let's address the first item on my list, which is of utmost importance: selenium. Selenium. If you choose to, you can incorporate a daily supplement containing either 200 micrograms of selenomethionine or selenocysteine to enhance the well-being of your thyroid gland. Selenium stands as one of the vital trace minerals required for converting the inactive thyroid hormone T3 into its active form known as T4. In essence, supplementing with selenium can expedite this conversion process, particularly for those with a sluggish thyroid. Research also indicates that selenium intake can decrease thyroid antibodies, thus mitigating the risk of your immune system launching attacks on the thyroid, which can lead to further complications. It's noteworthy that women, in particular, are 8 times more likely to suffer from hypothyroidism compared to men. This heightened risk, especially after pregnancy, often arises due to hormonal imbalances stemming from elevated or reduced estrogen levels. However, selenium rebalancing these hormones by promoting liver health and bolstering the body's antioxidant defense, including the vital glutathione. Now, moving on to the second supplement on my list, bile salts. Surprisingly, many are unaware that a significant 80% of thyroid hormone conversion occurs within the liver rather than the thyroid gland itself. Therefore, simply relying on thyroid medication may not address the root cause, which could originate from liver or gallbladder issues. These issues might include a fatty liver, gallbladder stones, or the accumulation of toxins like mercury in the body, all of which can trigger inflammation and hinder thyroid hormone conversion. If you're interested in improving your liver health, consider supplementing with bile salts. You can take 2 capsules before each meal of the day. This helps to thin out the bile in your liver, facilitating the conversion of T4 to T3, while also aiding in the detoxification of toxins such as mercury, other heavy metals, and harmful chemicals present in your diet that may irritate your thyroid gland. Number 3. Vitamin C complex. As discussed earlier, a staggering 90% of thyroid cases are attributed to Hashimoto's disease, an autoimmune condition where the immune system mistakenly attacks the body due to excessive activity. This often arises from damage to the gut lining caused by the consumption of grain-based foods like bread, pizza, popcorn, cereal, biscuits, cakes, and pasta, which contain the protein gluten. Thank you. Gluten damages the intestinal lining, creating tiny openings that allow toxins and undigested food particles to enter the bloodstream. As the immune system doesn't recognize these foreign substances, it launches attacks throughout the body, leading to inflammation and various health issues. Interestingly, the thyroid tissues share a similar protein structure with gluten, prompting the body to target the thyroid gland as if it were an invading pathogen or virus. This is where vitamin C becomes indispensable. A genuine vitamin C complex includes bioflavonoids that promote collagen production in the body and aid in the healing of the gut lining. For an added boost, you can incorporate 1,000 mg of vitamin C through sources like acerola cherry capsules or powdered fruit blends into your daily regimen. However, be cautious when selecting vitamin C supplements, as those containing only ascorbic acid, which represents a mere 5% of the complete vitamin C complex, may not be as effective. To truly heal your gut, it's advisable to obtain the entire vitamin C complex from foods like cabbage, sauerkraut, strawberries, bell peppers, and cruciferous vegetables. Number 4. Iodine and zinc. Trace minerals are indispensable nutrients that our bodies require in minute quantities, yet they play a pivotal role in catalyzing thousands of chemical reactions by supporting various enzymes. Previously, we emphasized the importance of selenium in thyroid health, as it aids in neutralizing free radicals produced during thyroid hormone synthesis, thus reducing inflammation and enhancing conversion. In addition to selenium, zinc is another critical mineral that facilitates the synthesis of new thyroid hormones. Iodine, on the other hand, serves as a fundamental component for the production of T3 and T4, the primary thyroid hormones. To incorporate more of these minerals into your diet, consider adding seafood options such as sea kelp, nori, kombu, Irish moss, mussels, clams, crab meat, and oily fish to your meals 2 to 3 times a week. Alternatively, you can opt for liquid trace mineral drops mixed with water or sea kelp capsules to supplement your trace mineral intake. These minerals not only support thyroid function but also contribute to healthy skin, hair, eyes, and nails by aiding in the regulation of cell growth. Number 5. Vitamin D3. Consider a daily intake of 10,000 international units of vitamin D3, along with 100 micrograms of vitamin K2. These vitamins play a crucial role in hormone balance and reducing inflammation in the thyroid gland. Vitamin D, in particular, acts as a hormone that modulates and regulates the immune system, preventing it from mistakenly targeting the thyroid. Research indicates that individuals with hypothyroidism often have insufficient vitamin D levels. Usually due to limited sun exposure or inadequate endogenous production, higher doses of vitamin D3 are frequently employed by functional medicine practitioners to address autoimmune conditions like Hashimoto's. Furthermore, vitamin D enhances liver function, promoting hormonal equilibrium and detoxification, which can mitigate inflammation in the thyroid. Before making any dietary or medication adjustments, it is imperative to consult your doctor regarding the use of these natural remedies. If you suspect you have an underactive thyroid and seek a definitive diagnosis, there are at-home blood tests available for your convenience. Now that we've explored various nutritional supplements for managing hypothyroidism and discussed testing options, let's delve into the underlying causes of this condition. As previously mentioned, excessive consumption of gluten or grain-based foods can harm the gut lining, triggering an autoimmune response in the thyroid. Another contributing factor is the overconsumption of deep-fried foods and inflammatory vegetable oils, which can damage the intestines and liver, leading to inflammation and toxin accumulation within the body. It's worth noting that approximately 80% of thyroid hormone conversion occurs within the liver. Thus, liver disease, especially in individuals who are overweight, can impede thyroid function. Prolonged mental stress, overtraining, or the onset of menopause can elevate cortisol levels excessively, signaling the thyroid to produce fewer hormones. Additionally, insufficient dietary intake of iodine and selenium from wholesome sources may hinder thyroid hormone synthesis. Certain medications, such as statins, diuretics, antibiotics, and blood pressure medications, can induce hormonal changes that weaken thyroid function. Now that you're aware of these factors, let's delve into 6 lifestyle tips aimed at enhancing the well-being and functionality of your thyroid. 1. Eliminate grains, vegetable oils, and gluten from your diet completely. This includes foods like bread, popcorn, canola and soybean oils, corn oils, biscuits, pasta, tortillas, rice, and more. Maintain this dietary adjustment for a minimum of 90 days. You can aid in the restoration of your gut lining by incorporating bone broth, raw garlic, kefir, sauerkraut, and low-glycemic berries into your diet. 2. Incorporate anti-inflammatory organic foods such as steamed broccoli, cauliflower, leafy greens, radishes, celery, and Brazil nuts into your meals. Include pasture-raised eggs, wild-caught salmon, sardines, grass-fed beef, organic pork, and shellfish rich in trace minerals. 3. Avoid adopting a low-fat diet, as your body requires specific fats for hormone production. Sources like virgin cod liver oil, pasture-raised egg yolks, and grass-fed butter are excellent providers of retinol, a compound that assists in activating specific thyroid receptors. 4. If you find yourself under significant mental stress and experience tension, consider taking ashwagandha capsules and enjoying lemon balm tea. These natural, ancient adaptogenic herbs can help reduce cortisol levels, alleviate stress, and balance estrogen levels, which could be contributing to hormonal imbalances. 5. Consider incorporating some of the supplements mentioned in today's video. So, particularly those containing bile salts, to enhance the conversion of T3 to T4 within your liver. Seek out supplements that contain bile acid factors, bile salts, ox bile, or TUDCA. These substances can aid in detoxifying the liver and intestines by eliminating toxins and undigested proteins. 6. Last, but not least, adopt timed eating habits. Consume all your daily calories within a 6-hour window, allowing your body 18 hours of fasting. You can still consume the same quantity of calories as you would throughout the day, but confine your eating to this specific time frame. This practice triggers autophagy, which can reduce inflammation, regulate an overactive immune system, and prevent further thyroid complications. To learn more about this topic, please like the video and subscribe to my channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Are you looking for that one magic substance that can enhance each and every organ and system of your body? Well, unfortunately, that doesn't seem to exist. But one that comes pretty close is none other than fish oil. Fish oil is loaded with omega-3 fatty acids, and numerous studies have revealed multiple different benefits that it provides for the human body. And that is exactly what we are going to talk about in this video. Be sure to watch until the end because there's one benefit that may surprise you. So, if you're ready, let's get into it. The first major benefit of fish oil that we need to point out is that it supports a healthy heart. For almost 20 years, the American Heart Association has recommended omega-3 fatty acids for people with coronary heart disease. The reason is studies found that EPA and DHA are properties found in fish oil that can boost the health of your heart and lower your risk of a heart attack. They also have been shown to prevent blood clots, reduce blood pressure, and improve levels of cholesterol and triglycerides, all of which can majorly improve the health of your cardiovascular system. Another major benefit is that it reduces inflammation. Many autoimmune diseases such as Crohn's, rheumatoid arthritis, psoriasis, and multiple sclerosis is linked to high levels of inflammation in the body. This explains why consuming more of an anti-inflammatory such as fish oil can have such amazing benefits on your overall health. The National Institutes of Health has overseen several trials of fish oil supplements for reducing inflammation, and the results were promising. Participants saw a decline in symptoms and didn't require as many prescription anti-inflammatory medications. Another great thing about fish oil is that it helps with weight loss. Studies found that omega-3 fish oil actually decreases your appetite and hunger. One experiment found that those who consumed fish oil on a daily basis felt much more full between meals than those who didn't. Some researchers even believe that omega-3s can boost your metabolism. Recent studies found that taking fish oil over 12 weeks raised metabolic rates up to 14%, which equates to more than 185 extra calories burned in a single day. Fish oil also supports healthy skin. Many people don't realize that our skin actually contains a lot of omega-3 fatty. It can affect the health and appearance of how your skin looks. Not to mention, our skin health naturally declines as we age. A lot of that has to do with overexposure to sunlight and UV rays. Fish oil can help mitigate some of the negative effects and maintain healthy skin over time. It is also believed that fish oil, who doesn't want to feel calmer and happier, right? A study by Harvard Health reported that EPA and DHA found in fish oil may actually be useful for preventing or treating mood disorders. Scientists have long known that mental issues like depression and anxiety are much rarer in countries where fish is a staple of the diet. That is because people who eat a lot of fish are naturally consuming more omega-3 fatty acids. Researchers also believe that fish oil helps improve eye health. Our eyes actually rely on omega-3 fatty acids in order to function properly. Studies found that those who do not consume enough omega-3s are at a greater risk of developing eye diseases such as age-related macular degeneration. More research is needed in this area, but preliminary findings do seem to be promising. Another benefit that we need to point out is that fish oil potentially reduces fat in the liver. As obesity rates are on the rise, non-alcoholic fatty liver disease is becoming more common and more deadly. If left untreated, it can lead to many different problems, such as cirrhosis of the liver, liver cancer, and liver failure. It is believed that fish oil plays a role in decreasing inflammation in the liver, improving functionality, and reducing the symptoms of fatty liver disease. Fish oil also potentially improves the health of your bones and joints. As we age, our bones naturally tend to lose some of their strength over time, which can lead to osteoporosis and osteoarthritis. When we think of improving bone health, usually the first thing that comes to mind is calcium and vitamin D. While they are definitely very important, people often forget that omega-3 fatty acids are very beneficial as well. Researchers believe that those who have threes have better bone mineral density. This can help keep your bones strong and healthy as you age. Fish oil has also been shown to improve brain development. EPA and DHA are the two omega-3 fatty acids that we've mentioned a few times already in this video. I think you can already tell how important of a role they play in the human body. This is especially true when it comes to brain functionality and development. Studies found that decreased levels of omega-3 in older adults is associated with a smaller brain size and accelerated brain aging. Omega-3 fatty acids are also helpful in reducing memory loss in those with cognitive impairments as well. Research is limited when it comes to proving that fish oil can improve cognitive functioning in healthy adults. However, it is believed that omega-3s can promote healthier brain cells and less deterioration over time. And we couldn't have made this video without mentioning the fact that fish oil may also strengthen the immune system. Our immune system works to protect the body from invading viruses and bacteria. As we previously mentioned, inflammation only makes matters worse. Unfortunately, there is no evidence that directly links fish oil to a stronger immune system. The benefits actually come in an indirect way. The anti-inflammatory properties of omega-3 fatty acids found in fish oil reduces inflammation in all parts of the body, which indirectly influences the immune response. This helps our white blood cells do their job by fighting off foreign viruses and bacteria. Real quick guys, do me a huge favor and hit the like button. It really helps support the channel and I greatly appreciate it. And while you're down there, go ahead and click the subscribe button as well because we have a ton of other videos on our channel that I think you will enjoy. Millions of people around the world are looking for natural ways to improve their overall health. Hopefully the information that you learned in this video can help you do just that. But hopefully you learned a thing or two by watching this video and hopefully you're now one step closer to improving your overall health and thus improving the quality of your life. If so, be sure to let us know down in the comment section below. Thank you so much for watching all the way to the end. Have a blessed day and as always, breathe easy my friend. Hi everyone. The sugar statistics in the US are pretty bleak. They say the typical American eats 6 cups of sugar every week. That's 152 pounds of sugar in a year. Why are we eating so much sugar? Well, first of all, it's everywhere. As the most popular food additive in processed foods, sugar is hard to avoid. Secondly, it's highly addictive. Most of us are addicted to sugar whether we realize it or not. Quitting sugar is a difficult task, but it can be done. And trust us, your body will thank you for it. In today's video, we will tell you amazing things that will happen when you quit sugar. From sleeping better, weight loss, better teeth, sharper brain to a clearer complexion and more. Watch till the end to learn about all of them. 1. You'll cut cravings. Foods filled with simple carbs and refined sugars like donuts, cookies, and white bread can cause dopamine spikes, causing sugar cravings. A study found that sugar may lead to an increased affinity for opioid receptors, which leads to more sugar and may contribute to obesity. Weaning yourself off the sweet stuff can help curb cravings and stop destructive snacking habits. What's the food you crave the most? Tell us quickly down below in the comments section. 2. Clear complexion. There are different types of food that can cause acne. Processed sugars are among them. Diets high in refined sugar, think candy bears, cake, and cookies, can lead to excessive insulin spikes. This triggers inflammation in the skin. As a result, elasticity and collagen, what makes your skin